All right, ladies and gentlemen, this is another article that came out on EHS today, December 12th, 2017. The economic value for employers of workplace drug testing. 70% of the 14.8 million Americans who abuse drugs are employed. So the odds that some of them are in your workplace are pretty good. The rate of deaths from drug overdoses in the United States between 2000 and 2016 has increased 137%, including a 200% increase in the rate of overdose deaths involving opioid pain relievers and heroin, according to a Medicare and Medicaid Research Review report. While opioid prescriptions have increased dramatically since 1999, the amount of pain reported by Americans has remained the same. Now, almost 2 million people in America have a prescription opioid use disorder, contributing to increased heroin use and the spread of HIV and hepatitis C. Impact in the workplace. Employees who abuse prescription drugs are 2 to 5 times more likely to take unexcused absences, be late for work, be injured, or violent at work. File workers' compensation claims, quit, or be fired within 1 year of employment, according to the National Safety Council. Furthermore, 70% of the 14.8 mil on Americans who abuse drugs are employed. When an employee abuses drugs, employers and taxpayers take on the risk of workplace injuries. Comprise compromised productivity due to absenteeism and actually, I did a video on this not long ago, maybe over a month ago, on how a lot of employers are complaining because due to the opioid plague that's going on, productivity is dropping dramatically on these jobs around the country because of drug abuse. And many of them are now complaining not only about not being able to find qualified workers, but even with the workers they have in-house, each and every year they're noticing a drop in productivity. Okay, drug abuse costs U.S. business owners more than $140 billion every year, which includes turnover rates for employees who abuse drugs. The drugs at the root of this issue include cocaine, heroin, ecstasy, meth, and prescription drugs. Time to step up. For many employers, the time has come to consider all available options for resolving the issue of drug abuse in the workplace. As the opioid crisis continue to penetrate across all racial and socioeconomic strata, hardworking middle class America has become devastated. Today, it's become an imperative to understand the implications and impact of this epidemic on America's workforce, gain a more comprehensive understanding of how deeply this issue cuts and take action. The designation of the opioid plague as a public health emergency in October 2017 took an important step towards solving a problem that impacts people of all ages and ethnic groups throughout the country. While it is expected that this declaration will offer states and federal agencies more resources and power, which really is required, is greater access to toxicology labs and drug testing. increase access to testing. Unfortunately, the U.S. system does not have the necessary capacity to meet the clinical demand for testing. And it's incumbent upon our nation's insurance companies and health plans to increase their contracting and reimbursement with an expanded network of labs that can meet the needs of medical providers who are ordering drug tests. With greater access to testing, both providers and patients will be better positioned to curb this deadly plague. The upside of this equation is that employees more likely will undergo treatment when it is fostered by an employer, and individuals in recovery go on to become better workers, using less health care, taking less unscheduled leave, and involving slightly less turnover than their non abusing colleagues. In fact, each employee who recovers from a substance abuse disorder saves a company more than $3,200 a year. So there you go. Problems with this drug plague are endless, ladies and gentlemen. You know, obviously, it's not easy to beat this addiction. If it was, we would have seen it turn around a long time ago. We are damn near at 20 years of this opioid plague going on in this country. 20 years. The crack epidemic didn't even last that long. Please tell me what you think, ladies and gentlemen. Please leave your comment and subscribe. And don't forget to hit on that notification bell. Peace, family.